Whether it's boredom, burnout, or a combination of the two, responders say problems standing in the way of filling volunteer ambulance crews have only gotten worse with time.
If you live in a rural area, it's probably 100% of your EMS is handled by volunteers. And if we don't have volunteers, then who's going to do it?
Volunteer EMTs make up quick response units, or QRUs, that gather crucial patient information to relay to city and rural emergency services.
When somebody would call 911, they would respond, get the patient stable, and report to us while we're on our way up what we had, so we'd know what we were walking into when we got there.
Belt Ambulance covers nearly 1,200 miles. Cantley says Cascade County has seen a steady decline in the number of quick response units, which means critical care can be delayed.
If you live in Monarch or Nyhart and you have a heart attack, you better hope you have a neighbor handy who has some experience going to be able to help you, because it's going to take us 20 minutes on a good day to get there.
Judith Basin County EMS says Geyser QRU has also lost volunteers over the last decade.
We used to have 10, 12 people here, and it's down to 4 now.
Those 4 also make up the entire Geyser ambulance services and also partner with the fire department. Responders say many rural EMS crews team up with other services to address shortages on both sides.
We use the fire department actually to help us when we don't have drivers, because we're so rural and very short-handed. So the fire department fulfills that role for us, and they're part of our system and our team.
EMS is not considered an essential service in Montana like fire and law enforcement. Hill says that means they are subject to county budget cuts, so they rely on grants and donations.
We wouldn't be able to function without those grants.
Another challenge facing rural crews is the amount of training required.
I go in here and think, oh, I'm just going to be an EMT, and they throw this book at me that weighs more than I do, and I'm like, oh my gosh, what am I doing here?
Responders say earning a basic EMT license takes hundreds of hours of study. Along with certification, volunteers must pass written and practical tests and take continuing education courses and training like a mass casualty exercise.
Fairfield Ambulance, please respond to 13 First Street Southwest.
A big hurdle is pairing volunteer hours with a job and raising a family. But some volunteers say they are passionate enough to make it work.
I still can do a lot of the training and things, so I'm still a part of it. But yes, I can spur of the moment leaving the house for an ambulance call is a little bit harder.
Employers are also less willing to let volunteers respond to emergencies during the day. Hill says 2 of the 4 people in her crew must take vacation pay every time they answer a call.
People are actually forking money out of their paycheck to run as a volunteer.
While Montana's aging population isn't the best demographic for volunteers, responders say candidates 50 to 60 years old could be part of the recruitment solution.
They're very capable of doing the job. They're interested in lifelong learning, and they have enough life experiences to be able to do the job. And they actually have the time.
Another solution that could utilize aging recruit skills is the concept of community health EMS. The Montana Department of Public Health and Human Services says the program could increase patient access to primary and preventative care and reduce emergency room visits. On special assignment, Keeley Van Middendorp, MTN News. Back to you.